If you've ever twisted an ankle or strained a muscle, you probably reached for ice. The RICE protocol, rest, ice, compression, and elevation, has been the standard advice for decades. Here's what's interesting: the physician who coined RICE, Dr. Gabe Mirkin, publicly reversed his recommendation. He now says that the evidence does not support it. Hi, I'm Heather, and I build longevity protocols where biological systems science meets the source code of reality. The reason comes down to what inflammation actually is. When you injure a tissue, the inflammatory response is not a malfunction, it's a repair sequence. Your body sends immune cells, growth factors, and signaling molecules to the damaged area. Swelling increases blood flow and delivers the raw materials for tissue repair. That acute inflammatory response is the beginning of healing. It is not a problem to suppress. When you apply ice, you constrict blood vessels and slow the entire process. You reduce pain, sure, but you also delay the delivery of immune cells that are trying to do the repair work. The newer framework in sports medicine, called Peace and Love, has moved away from immediate ice application for exactly this reason. Peace and Love stands for protection, elevation, avoid anti inflammatory medications, compression, and education in the acute phase, followed by load, optimism, vascularization, and exercise as recovery progresses. The framework essentially splits injury management into two stages. The first few days are about protecting the tissue and letting the inflammatory repair processes work without suppressing it chemically, and then longer recovery phase focusing on gradually reintroducing movement, blood flow, and mechanical load to rebuild tissue strength. The avoid anti-inflammatories piece is the real departure from conventional wisdom. It's explicitly saying that reaching for ibuprofen in the first 48 hours may feel helpful, but is actually slowing that same repair cascade that the icing disrupts. Now, this isn't about chronic inflammation, which is a different animal entirely. Chronic low grade inflammation is damaging and worth reducing, but acute inflammation after an injury is your body's intelligence in action. Learning to distinguish between the two and knowing when to let the body's own repair systems do the work is the kind of biological literacy that changes how you approach your own health. Not every built in response needs to be managed. Sometimes the best intervention is understanding what your body's already doing.